of our meeting, and we are adding a few boards. We're going to take a few minutes to go around the room, or not the entire room, but around this portion of the room, and let everyone introduce themselves so we're familiar with everyone. Going forward, I would ask, for those of you unfamiliar, if you would like to speak during the meeting, to just please set your card sideways in a manner where I can easily read it so I can call on you. We will start from the left side of the room and work our way around. Yes, please.
Good afternoon. I'm Darcy Davis, CEO of the Healthcare District.
Hi, good afternoon. I'm Lisa Williams-Taylor, CEO of Children's Services Council.
Commissioner Joel Flores, District 3.
Gloria Branch, School Board Member.
Good afternoon, Robert Shea, Child Protection Director, DCF.
Greg Wise, Palm Beach County Commissioner, District 2.
Good afternoon, Erica Whitfield, School Board Member.
Good afternoon, Dr. Jyoti Gunta. I'm the Director for the Health Department as well as a board member for the Healthcare District.
Hi, I'm Judge Kathleen Kroll. I'm the Administrative Judge to the Juvenile Division.
Good afternoon, Maria Marino, County Commissioner, District 1.
Good afternoon, I'm Karen Brill. I'm the Chair of the Palm Beach County School Board. Welcome to District 3, which is my district.
Good afternoon, Jose Luis Rodriguez, Vice Chair, Children's Services Council.
Thomas Bean, Chair, Children's Services Council.
I am Mayor Sarah Baxter, also the Commissioner District of District 6.
Hello, Vice Mayor Marcy Woodward, Commission District 4.
Hello, I'm Pat Rooney. I'm the Chair of the Healthcare District.
Good afternoon, Tammy Jackson Moore, Vice Chair, Healthcare District.
Good afternoon, Tom Weber, Secretary of Children's Services Council.
Hi, everyone. Tracy Caruso, Secretary for the Healthcare.
And good afternoon, Marcia Andrews, School Board Member, District 6.
Good afternoon, Kathleen Ward, Board Member of the Healthcare District.
Good afternoon, Virginia Saviero, School Board Member, District 2.
Good afternoon, Albert Barotto, Board Member, Healthcare District.
Good afternoon, Joseph Abruzzo, County Administrator.
Hi, Mike Burke, Superintendent with the School District, and I'm also on the Children's Service Council Board.
Leanna Figueroa with the Clerk's Office.
Todd Von Laren, Chief Deputy County Administrator.
Tammy Fields, Deputy County Administrator.
Elisa Kramer, Palm Beach County Youth Services Department Director.
James Green, Director of Community Services Department.
Deborah Gottlieb, General Counsel, Chief of Legislative Affairs, Children's Services Council.
Keith Oswald, Chief of Student Health and Wellness, School District.
Heather Frederick, Chief Financial Officer for School District of Palm Beach County.
Yolanda Morgan, Chief of Staff, Palm Beach County School District.
Jamie Wyatt, Deputy Superintendent, School District of Palm Beach County.
Sean Cooley, Chief of Communications and Engagement, School District of Palm Beach County. Thank you.
Matt Lane, School Board Vice Chair.
School Board Member Ferguson, would you like to just introduce yourself briefly?
I think you did a good job for me, Chair. Edwin Ferguson, Palm Beach County School Board, District 7.
Thank you. And thank you, everyone, for being here.
Thank you, Madam Mayor.
Please let the record reflect Commissioner Powell has joined us, and he's District 7, and Commissioner Sachs, who's District 5. This is her district.
Thank you, Madam Mayor, chairs of the respective boards, members of the board, staff, and others, and guests. We want to first off start by saying thank you to each and every one of you for coming together for this meeting, this joint meeting. It's been quite a while since we've had a last one of this many boards together. And we thought that there were a number of different issues that were relevant today that warranted this particular meeting. Just to give you a little overview of the agenda as we lead into it, you all introduced yourselves. We'll get to a statement of purpose of the meeting, provide a brief history of our last convening that we had in 2013, our shared successes and challenges amongst collectively the boards, and I do want to thank the staff of every one of the organizations. We have worked tirelessly over the last several months putting together this joint presentation for you. We'll talk about the collective impact of the work that we've done between the four entities, particularly in mental health, homelessness, funding, and talk specifically about some of the funding mechanisms that we have there, outcome data, which is, I hope, going to be a good topic of information, and particularly as we look forward, joint legislative priorities. We thought as a takeaway from this meeting that we had an opportunity to work collectively on some items that we thought we could all support. And there's actually a draft letter in front of you on the bottom of your pile that we put together, subject to change, that we'll work on as we get later on into the meeting about some of the specific items on that slide, and then a wrap-up and some next steps that we want to talk about. So the first about 8 to 10 slides of this presentation today are really more for background for you. We introduced everybody on the Board of County Commissioners, some information about how our Board of County Commissioners came about and what we do. The next slide is our school board members, then a slide about some of the work that the school board does and the makeup of the schools in terms of students and employees. Our Children's Services Council, backup information there, as well as some information corresponding to some of the work and authorizations that were given for the creation of the Children's Services Council about 40 years ago. And then the Board of Commissioners of the Healthcare District and the enabling legislation that brought about the Healthcare District. So you can refer to some of that information as we go on. We didn't want to spend too much time on that, because we want you to be able to have an interactive conversation. As staff, we're going to present some things to you, but we hope that at any time during the course of our discussions that you have relevant information or discussions that you would like to have, please feel free to do that, and we're going to create an open dialogue. So first off, how did we get here and why? In August of this year, our county staff was directed by the board to organize this meeting between the county, the school district, Children's Services Council, and the Healthcare District. And the goal of it was to explore how we could better coordinate some of the programs, funding sources that we are currently utilizing to serve our community, our families, our children throughout the county. And it was really an opportunity for us also to look at, as we look at how we're spending our dollars, whether we're duplicating efforts or maybe not meeting expectations in some areas of where we might need to be doing better, and then how we might look at streamlining services and address any shared concerns that we have. It's been over 12 years since we last came together with the school board and Children's Services Council, and we thought it was very important to add the Healthcare District, who's been a great partner with us, particularly in the mental health space, and we'll get into some of the details of that as we move through, and I will turn it over to Tammy Fields to take us to the next items.
Good afternoon, all. We thought it was important to start with a brief history of what occurred starting back in 2012. The joint work that is being done through Birth to 22 and by all of these boards collectively really started as a result of a tragedy, and that was the Sandy Hook Elementary School shooting. The Board of County Commissioners, school board members, some of our judiciary, and others all said at that time, what do we do in Palm Beach County to make sure we don't have anything like that happen here? And the result of that was planning started to occur to hold a infant, child, youth, and young adult symposium. So that was the last convening of 3 of the 4 boards that are here, and that was in September of 2013. The recommendations that came out of that convening went to the various boards in April of 2014, and some direction came from that. One of them was to move forward and have a youth services department as part of the county. And the youth services department, one of the assignments was to really be a coordinator, make sure that all of the entities that are here today, including all of our nonprofit partners, are working together on a joint mission. Our board, Adam, if we can go back just a minute. Our board voted on that. Youth Services Department started officially in January of 2015. And one of the things that happened at that point was also that the Head Start program, which had previously been operated by the county, became part of Lutheran Family Services. And agreements were reached between the Board of County Commissioners and the Children's Services Council as far as focusing on evidence-based programming and also making sure that the Head Start program was supported. And then in 2019, the school district was able to add a behavioral health professional at every school. I will say part of that was another tragedy, and that was Marjorie Stoneman shooting. And one of the benefits of the collaboration that is in this room is that we met as the Birth to 22 Coalition within 24 hours of that shooting to talk about what Palm Beach County could do. So even before any legislation was passed, Palm Beach County was one of the first counties that had a plan in place, and mental health and security were two of the priorities. The other thing that came up, and I hope you were able to see some of the exhibits that were out in the hallway, is the creation of our steps to success. For our kids, there's many steps along the way in order for kids to be able to enter adulthood with success and be prepared for adulthood. And that starts with being born healthy, that maternal care. So we started there and have we've got metrics that we look at each one of those steps along the way. Obviously, the goal for our kids to be career ready as they reach adulthood. There was also some things that were assigned to all of us, including the interagency coordination, making sure that departments within the county were coordinated, working with our court system. We've worked very closely with Judge Kroll and her predecessors over the years, making sure that there was a family visitation center, which is one of the successes we have, and that was done with partnership as well. And looking at our children with special needs, as well as making sure that the youth program we were putting in place would work for all. The outcomes that we were focusing on were to increase positive birth outcomes, improve health, safety, improve health, safe, permanent, and nurturing environments, and that's for our families as well as our children. Improve physical, developmental, mental health, and behavioral health, improve school readiness, increase educational performance, increase adolescent prosocial behavior, and increase career readiness. As you can see, all of those outcomes affect all four boards here. So the next few slides, and I'm not going to go into these in detail, but the next few slides, starting with birth to 5-year-olds, is what each of our organizations are focusing on in that arena. As you can see, each agency has a role in supporting, including making sure that children are born healthy and then ready for school. And then as we move along the steps of success, we're looking at the ages of 6 to 18. Again, every single one of the agencies have a role. The healthcare district is in the school with the school nurses. We have the Bridges programs. We all work for our unsheltered families, and we've got the school district, who is an A-rated school with many different choice programs along the way. We also focus, and this is a focus that youth services was given and done in conjunction with community services, is the 18 to 22-year-olds. For any of you who have adult children, you know that at 18 they're not fully baked. They need a little help along the way, and some families are ready to provide that help, but unfortunately some children don't have that available to them, especially our children that are aging out of foster care. And so we have a focus there. And then, of course, we have a focus on parents and families. You cannot address the needs of children without addressing the needs of the entire family. And that's one of the things that is so important, is that the entire family is healthy, both mentally and physically, and has resources available and can be sheltered. So we have many different programs for the families and parents. And then we go on. One of the things that was decided during the symposium was to employ a collective impact approach. And so the collective impact, the elements of it is that you unify major governing bodies. We see that in this room. We strengthen the countywide coordination, and it's really important to focus on coordination. It's not duplication, it is coordination, and that's what the next bullet highlights, is that we're trying to make sure we're maximizing the public dollars by reducing duplication, so that we're all working in our spaces where we're the experts. We're working on data-driven decision-making. A little bit later, we will focus more on what's going on with data collection, and that we're also building trust among all our stakeholders. So that's not just you here in the room, but it is all of our children and families in the county. Wanted to highlight, and there's more in your package. There's a document that looks like this, that just has some of the highlights. And then you also have a complete data book of everything that we track on those steps to success. And we've been tracking that since 2013. And we publish the data deck every 2 years, and it just is packed full of information. And it's all aggregate information. So one of the wonderful things is looking at the high school graduation rate. In 2013, when we started this, it was 77.9%. It is now up to 92.1%, a substantial increase. We also have had a significant reduction in victims of, child victims of abuse and neglect, going from over 1,200 child victims in 2019 down to 805. 805 is still too many, but we are showing progress. And we're also making sure that developmental screenings are occurring for our kids before they're getting into school, really focusing on that school readiness, and that is now up to over 14,000 kids in the 2023-24 school year are all being screened. But even with those successes, and there's many more in the exhibits that you have, we still have some, well, oh, wait a minute, I almost forgot a few extra successes. One of them is that higher participation now in VPK. The Early Learning Coalition is also an important partner in that, but we have a lot more 4-year-olds that are participating. Palm Beach County is at 73%, the state of Florida is at 66.7%. We've got more kids that are receiving scholarships to either attend after school or summer camps. We're up to almost 17,000 children are receiving those each year. And another important one is the 13% decrease in the number of youth who are drinking alcohol. In the attachment, you'll also see that there's a substantial decrease in the number of children who smoke as well. But with all successes, we also have some challenges that are continuing, and we saw some of these really arise during and post-COVID. Unfortunately, births, women who are receiving first trimester prenatal care has decreased lately. Some of that may be attributed to some of the economic conditions and mothers being able to access care. We've also seen a substantial increase in chronic absenteeism, and chronic absenteeism is more than 10 absences in a school year. That has increased from 11% pre-pandemic up to 19.8%, an area that we all need to focus on. And then this one is a disturbing statistic that 24% of our students in middle and high school are reporting that they feel sad or hopeless for more than 2 weeks in a row, and so they're stopping their normal activities. We need to re-engage our students. On a flip side, I will report that we've now had 5 consecutive months of no youth suicides under the age of 18. So that is definitely something to be celebrated. Before we go on, are there any comments on what we've covered so far as the history and what our successes and challenges are? Okay, I'll move forward. One of the things that we all employ in the collective bargaining is really looking at the health and human services element that is included within our comp plan. But if you look at this wheel, and I apologize, the print is small, but if you look at this wheel, you'll see that there are all agencies in this room are taking the lead in one of these areas. But in order to address the resident as a whole, all of these elements of the ecosystem need to be covered. Our Board of County Commissioners, you'll recall, you've also seen this same graphic when we were talking about the opioid spending plans as well. And then we're going to focus today on a couple of elements, just two of where all 4 agencies are working together in the area of mental health. We could not do anything without having our mental health and everything from prevention all the way up to recovery supports and residential treatment and acute crisis being handled. And one of the major players in that and has really stepped up to the table is the healthcare district. And so I'm going to turn it over to Ms. Davis to continue.
Sure, thank you, Tammy. So Healthcare District has really expanded our footprint in the mental health space since 2017. We responded to the call to action during the opioid crisis and have really continued to invest in our providers and all of the things. We'll talk a little bit in a minute about the building and the approach we're taking, but this slide is representative of really us building up the workforce and the infrastructure that it's going to take to support a true cohesive effort for mental health. So just as, bucketing these in crisis, for example, we have MOUs with almost all law enforcement agencies. They know to bring patients to us. We have providers that are in the back of co-responder units with the sheriff's office. And we've recently entered into an arrangement with neurobehavioral hospitals to reinvest in some pediatric Baker Act beds. So when the local community partner, the local community hospital stepped out of that space, the healthcare district stepped up and we have funded beds. We ultimately hope to operate those, and that's, we're going into that knowing that that's a longer term plan, but right now NBH is a good partner who's converting some adult beds into pediatric beds. We have continued to have immediate care, so we have walk-in appointments. At our Mangonia Park location, we are actually open 7 days a week, 7 a.m. to 7 p.m. We're making ourselves accessible. We're building that workforce to understand how we can respond real time when somebody walks in and somebody has the need and recognizes that now is the time to seek help. Our follow-up care, all of this that we're doing is on our federally qualified health centers because we have the infrastructure to be physical health providers, but it's typically the same patient. The same patient that has a stomach ache, often has anxiety, and so they're, we're capturing in an integrated model. We're capturing a patient in that physical moment, but we're screening them also for any behavioral health needs, substance use needs, and so we've built a workforce. Our psychiatric providers, we continue to add to those, in addition to our director, who many of you know and have heard. She's in the room behind me. She's a board-certified addiction psychiatrist. We also have a child psychiatrist, other adult psychiatrists with specialties in geriatrics, and so on as we continue to build the infrastructure. This graphic on the right-hand side is just a visual of where we're going, because ultimately the model that we're looking to build is best practice across the country. It will have under one roof emergency crisis care where fire rescue, law enforcement can come. It's jail diversion, it's ER diversion. And then we also have that urgent crisis care moment where somebody can walk in all the way through to outpatient care, and we anticipate having our community partners there as well. So for those people that come in that need support beyond the medical, we will be there with our partners, offering housing assistance. We'll be working with our partners to offer housing assistance, food assistance, whatever their needs are. So next slide, if you will. So really, I think this is not news to anybody, hopefully. We're building a crisis center. We have purchased the land at 100 Benoist Farms Road. This is about a $145 million investment from a capital perspective. The county has funded about $10 million from ARPA dollars towards that capital investment. Our ongoing costs, we anticipate being about $35 million a year to operate this facility. And we're currently in the planning and design phase. So tomorrow, hopefully, fingers crossed, our board will approve our construction contractor, and we are beginning all of the site planning and beginning to start moving for opening late 2028, but they tell me to say 2029. I'm trying to make that faster. So I think that's my update. If you have any questions on mental health. Anyone?
We'll pause for a moment because I know mental health is a topic that we've heard from many of you is a priority. So if there are any questions regarding what is happening or any input as to where you would like the staff of the various organizations to be focusing in the area of mental health, we'd love to have that feedback.
Commissioner Flores, you're recognized.
Yes, thank you. So mental health plays a critical component into some of the work that we all do and that we all face every single day. It touches on the lives of every single individual, the school district. When we talk about opioid addiction, there's a mental health component. When we talk about homelessness, there's a mental health component to it. I don't know anyone that hasn't dealt with mental health at some point in their lives. And it can affect us at any moment's notice. So we've had some issues in the county, and I know mental health is a priority to me. From what I've heard from my board, I know that the Palm Beach County BCC also is prioritizing mental health. But I want to sort of give Marcy and her team, Darcy, I apologize, Darcy, and her team kudos for stepping up, because when we had a shortfall where kids who were Baker acted weren't able to be treated in the county, you took this seriously and you guys look for solutions. And I think that's what we need to do when we are addressing across county issues. So I just want to say thank you for stepping up, for working on building this facility. And I'm glad that the Board of County Commission was able to provide that $10 million towards this building. So just want to say thank you. We're not where we need to be, but I think we're sort of starting that, taking that first step. So thank you.
Thank you.
School Board Member Whitfield.
Thank you. So similar to Commissioner Flores, I was interested and I wanted to ask some more clarifying questions about children right now under the age of 12 who may be Baker acted. What is their situation currently? How are they being handled within our community?
So they're, I'm sorry, go ahead. Okay. So they're still going to JFK North for screening, but they're being transported out of county. We're hopeful that NBH will get the license that they need. They're doing all the construction now. But so that they're looking at March or April being able to actually have those beds online, which is as fast as they can go because they know the urgency, but.
And so have you seen any other places where there are significant gaps within our community for mental health services beyond that? I know we've talked a little bit about the medical respite that's been addressed over the years. I know we've talked a little bit about how we can tackle it from, making sure that we're having inpatient beds. Is there any other place that this community should be looking at for future plans beyond what you're doing?
I would say it's less about the individual resources, and to me, it's more about the collective system. I think ultimately, the system starts with a 211 call or the 988 call, 988 to mobile response to, somewhere to take someone. And I don't think, it's cohesively working yet, because most people should be able to get that call, get that issue, at least get direction and care navigated immediately. When they pick up the phone, they need to know where to go and what's going to happen. And I think we're getting there. I know the managing entity is working very hard, and 211 is working very hard to start pulling the pieces together. But I think, individually, there are resources, but nobody knows how to get to them. And so I think it's really the collective system that needs to continue to work together to make it more navigable.
Thank you, that's very helpful.
School Board Member Whitfield, if I could also add that there's definitely, and we're working very hard on the crisis element, but the other thing that we see in mental health is being able to address those situational needs. A divorce has happened in the family, there's been a death in the family, and there's a situation that is ongoing that may not be the same as that rises to the level of crisis. That's one of the things that is occurring with the Youth Services Department, where a diagnosis code is not required in order to be able to receive services, but we can address those situations when they rise. What we all know is adverse childhood experiences. We have many of our nonprofits that also help us in that area. Be able to deal with situations when the kids are young, and be able to build resiliency. And so the range of programs that are available, starting all the way down to prevention and early interventions, all the way through the crisis, that spectrum is what we need to fill out even more.
Commissioner, are you finished, Ms. Fields?
Yes.
Commissioner Sachs, you're recognized.
Thank you, Mayor. I'm very pleased, Darcy Davis, with the issues that you have. And on page 24, you state that pediatric Baker Act beds for under 12, you do provide those now or not?
No, we're funding those for NBH. They are not operational. We expect March or April they'll be operational. And then long-term, once we build our facility, we will operate those.
So do you need funding to have, I know we talked to JFK and we said that we were going to discuss this like maybe a year ago in the county commission, that they were going to continue Baker. Now our children have to be bused to another county.
Correct.
For underage. Is this the only answer, is to have them probably in March or April of 2026? Is that the earliest?
That's, yes.
And it will be at your new facility?
No, and this will be on 45th Street, where right next to St. Mary's. Neurobehavioral hospitals currently exist. They do adult Baker Act beds. They're converting some adult beds into pediatric beds, but the delay is really licensing and construction, because there's special circumstances for children. So anybody that would be doing pediatric Baker Act beds is going to require time, construction, and licensing, other than the ones who were already providing it. The people who had the license to do it could have continued to do it until we could have filled the gap, but that ship has sailed, so.
JFK North
Yes.
refuses to continue their care for Baker Act for pediatric patients, and that's it, huh? They just walk away from it, no consequence. I'm sorry to hear that.
There you go.
So I'm very pleased that your department is going to pick this up. So hopefully, April of 2026, hopefully, come back with us and tell us, and if there's anything you need from the board, I think we'll certainly review it, because this is a big deal.
Thank you, and I want to thank our board, because that was something that they reacted to. We found, we looked through our budget, and they were able to come forward with some funding to help get neurobehavioral operational.
Excellent. Thank you very much for that.
Thank you. School Board Member Karen Brill.
Thank you. So it's no surprise to everybody in this room, for the most part, that I'm a huge advocate for our students and children with disabilities. And there is a gap that I just want to identify. There's no easy answer for it, and I'll give you a specific example, but I have heard from some parents, and I'll tell you about one in particular, that when their child, for example, with autism, who's in the spectrum or has autism, needs counseling, the counselors focus on the autistic behaviors and not the issue that's causing the problem. For example, one parent who was going through a divorce, their child started going through a crisis, and reportedly the counselor was focusing on the behaviors and not the child's behaviors, couldn't get beyond the issues with autism. And although the children and adults who are disabled are not a huge part of our population, I'm hoping that, especially in the crisis center, that we have some experts that understand it, because these parents feel that they're at a loss, that nobody can get beyond the autistic behaviors to reach the children with Down syndrome, to get to what's actually the cause of their issues. So I just wanted to put that out there on your radar. And thank you for all that you do.
Thank you. I do have a subject matter expert in the audience. I don't know if you want to hear more on that or not. Mayor Baxter, to speak to the autism, or do you
like to say something briefly?
This is Dr. Phillips. She's our Vice President of Behavioral Health.
Welcome, Dr. Phillips.
Thank you. Thank you for your comment. And I will just say that what you're speaking to, I think, is a little bit of a workforce issue. So what I can say is that the new facility that we're building, thanks to the board, thanks to the generosity of the commission, will be a starting point. It will by no means be an ending point. What you're speaking to is a highly specialized population that also has other things going on. And I think what we typically do at the district is we start collecting the data, we start seeing what's happening, and then we use that to move the chains of where we need to be next. Perfect example of that is I was just talking to the Homeless Housing Authority. We see that we're having a hard time getting patients back who have no phone and no home, so we're doing some different things to try to shake up that population. What you're speaking to about autism with extra needs, I think we need to have a place for them to get started, start to identify what's happening, and maybe that could lead to some workforce development changes in the future. For example, partnering better with some of the local colleges who train therapists to get them that training. But I do fully see that this new center is also a training hub for a lot of our workforce. We don't have that pace-setting university county hospital system that some counties have that helps churn out these specialized trained therapists that fill these gaps. And I think that this crisis center could definitely be one of those places. So I'll stop there.
Thank you. Commissioner Weiss, you're recognized.
Thank you, Mayor. Couple of things. On page 21, we talk about 24% of the students, middle and high school, reported sad or hopeless. And I think so far everything I've heard has to do with after the fact. How are we going to help them after the fact as it relates to pretty much every, well, except on the birth side and so forth. These, I believe, are a huge problem in society, especially our society with kids. And until parents and the rest of us, and I know the schools now have imposed restrictions on use during school time, but these are a real problem. They give children a look at the world that is not accurate, that how they are perceiving themselves in poorly, and then the ability for other students to, bully them and do things that they would never say to their faces. And I believe that's a lot of what's happening. So, I think it's important that we continue, and maybe it's an education program for parents, of how to control the type of access and the things that they can do. But I certainly think we need to look at the prevention of some of these conditions. And then something you'll, and it's no surprise to county staff to hear this from me, but we don't have a good ability to understand what's happening for the whole family unit. Things are happening and the systems don't talk to each other. And that's opportunities when and as somebody, I think, somebody mentioned, you know, a family's going through a death or a divorce. That should alert folks to the potential need that there may be services needed for people in that household. Or it could be dad losing his job, or somebody getting arrested. And again, these systems don't talk to each other, and that's missed opportunities to try and get at these issues before they become bigger. And so I think that's something I would really like to encourage that we, going forward, and I know there's talks of how we can do this, but I think it's a priority in getting our data together from all these different agencies to help better direct our resources and to better be able to serve the folks that are being challenged by things happening in their lives.
Madam Mayor, if I could address that question, and thank you for raising it. Dr. Lisa Williams-Taylor, a little bit later in the presentation, is going to go over the aggregate data. But you're correct that that individualized data is something that we're working on, and there are a multitude of different systems. We've been having meetings at the suggestion of the board with the Center for Child Counseling and the data set that they have developed and how we can tap into it. We met with ISS yesterday. Commissioner Weiss, you would understand the language much more than I probably did during the meeting yesterday, but we are working on having releases being signed by all of the different agencies that we're funding. There are challenges legally from the education records and health records, but how do we get families to allow us to share information with each other so that we can intervene? We're going to be building some APIs in order to have some of these systems interface. So that is a project that all of our staffs are working on right now.
I'm very happy to hear that. And then lastly, I guess, is and to thank you to the state attorney, the public defender, and our court system and law enforcement in our expansion of our mental health court. That's trying to keep people out of jail who are suffering from mental health issues. They're not criminals. They may have been involved in a criminal act, something that is considered a crime by statute, but it was due to their mental health. And so that hopefully will reduce the impact on folks in the sheriff's jail. And I understand that's right now for misdemeanors, but they're also expanding that into some felony cases as well, which is certainly the right way to go. And we have many examples here in Florida of other communities that have moved forward on this as well.
Kathleen Ward.
Thank you. And I know this was discussed actually just by Commissioner Weiss as well as the prior speaker, but I wanted to harp a little bit more on prevention because when we talked about approving the funding for the beds, the psychiatric beds for our youth, while yes, it's necessary and I did vote for that, I don't want the discussion to be lost on the fact that it really should be focused on prevention. Separating a child and putting them in that situation is very, very traumatic. And while we've looked at the foster care system and things like that of, hey, the last resort should be separation, the same would go for that. And so while, yes, there's a gap, and yes, we were trying to figure that out and working collaboratively to make sure that there aren't beds, I think the bigger topic and the more important topic of discussion for our minds are getting to that prevention aspect and not focused on, okay, well, at least we have these beds, so when that happens, because again, then you have the trauma, then you have all these other things to worry about versus focusing on that prevention. We're doing it in homelessness, we should be doing it in healthcare, because that's where we'll get more bang for our buck when it comes to actually solving these problems.
Thank you. School Board Member Andrews?
And thank you, Tammy and Darcy, and we're broken down in small groups, working together anyway, and when I look at all the work that we've done here, it's absolutely fabulous. But I'm really happy with the crisis center that's coming. It's really right in the heart of District 6 off of Benoist Farms Road, and it says accessible to all 39 municipalities within 1 hour drive. And so many people do not have transportation. So I know maybe Palm Tran is in here and transportation under the county. And even now, before we even get this facility, do we have a mechanism in place when someone is in a crisis that we have transportation to come get them and take them to wherever they need to go, even before this facility? And is it something that people really know that when they're in desperate need of help, they can just call someone, they can get help, and someone's going to take them, not the ambulance, but someone who's going to come in there and take them where they need to go, because this is a 1 hour drive, but as you know, this is a big county, and even though it's centered right there in the heart of Palm Beach County, which is a great thing, I worry about people being able to get there and knowing that they're going to have a way to get there if they need transportation immediately.
Right. So actually, the whole continuum that I was mentioning, you know, from the phone call, the mobile response teams is a key element. So when somebody is calling and entering the system, somebody on that phone is screening them and hopefully sending a mobile response team to them for a quick need. That mobile response team will go to the home, and if they can't de-escalate, then they can take them to the location. They can take them to the place. But so the other thing you saw in my presentation was that law enforcement, we have MOUs with almost every law enforcement agency in Palm Beach County. So we're seeing many of those in crisis, law enforcement is the first to respond. That's not always the best use of them, but at least we're giving that law enforcement officer a place to take them. And we are piloting with the sheriff's office, we're piloting where they will have a mobile unit that also goes to the scene with our trained professionals that can bring the care to the individual. So we're trying different avenues, but we recognize that transportation, it is a challenge. Unfortunately, when it's a crisis, you do tend to get, whether it's fire rescue or law enforcement, they're typically the first to respond and then transport. So.
And just to follow up, please, Madam Chair.
Go ahead.
With the mayors of these cities, have we in-serviced them? Because yes, law enforcement and all the others who actually do this work every day, but the people who live on the ground, who have issues every day, trust people that they know. So with all the great things that we're doing, are we in-servicing the local leaders and communities so that they can actually get to the people and let them know? How does that work with that in-service?
We can do a better job for sure. I mean, we've done a lot of presentations, but we can do more. We can talk to the League of Cities. We can, you know, we'll take our show on the road and let everybody know what we're doing.
Thank you for that. Vice Mayor Woodward, you're recognized.
Thank you, Mayor. And I wanted to thank Commissioner Ward for bringing up prevention. Really is important that these, hopefully, it's a rare occurrence that we have. And I think right now it is somewhat rare, which is also why JFK North perhaps pulled out of it. I was concerned with my fellow commissioners and had a number of meetings, and it was interesting to have the conversations about how important it is when the child has reached this level of crisis. Two things are very important. One is that they're not mixed in with adults having the same crisis, you know, they're children. And secondly, it's really important that they are socialized with other children at the same time. So we're not Baker acting them in isolation, because that is not helpful for them either. And part of the good and the bad of us having such a rare occurrence of it is we don't have a lot of children at the same time having these crises. So I was wondering if you could speak to how this is going to move forward. I mean, because right now we send them to a facility in Broward, I believe is the most common place we're sending them, because there's more children in the same place together. So when they're going through the therapy and bringing them out of crisis, they are with other children, and there's people specializing in this. They're not mixed in with adults. It's very categorized. So can you tell us, how does this look moving forward? And, you know, as we're funding this, again, if we're working towards prevention, which is the ultimate goal, to not have a child reach this, how do we balance the investment in this and making sure that if they are in crisis, they're with other children?
So the best practice is that you don't put them in a bed in the first place, and you put them in chairs. So they literally are recliners and pods. So the facility we're building has a completely separate track for children versus adults, and there are 8 chairs per pod. The facility will have beds for those children where there's just, that you cannot de-escalate and it's not working. But they will be socialized. It's a non-restrictive environment where the staff wraps around the child. Clinically, again, I could get Dr. Phillips to speak exactly to what's going on in that chair, but you're not isolating them. You're not putting them in a room and closing the door. You're trying to address and de-escalate in a calming environment. You think about it today, if somebody goes to the emergency room, that's very traumatic even for an adult. There's a lot of noises and lights and movement, and so, the idea is to take a child away from that type of environment. So between now and the time we get online, I think the best thing we have is those beds at NBH, because at least there is, they are well versed in child psych approach, but that's not the best solution long term. I think what we're proposing and where we're moving is to not put somebody in a bed. You put them in a chair. It's a 23-hour observation, and beyond that 23 hours, if it continues to escalate, well, you do have a place for them to sleep. You have a room for activities. You have a way to address the child. So, what you said is exactly right. It's not best practice to isolate and put them behind a closed door. So we're trying to get us to that place. We're trying to move as fast as we can.
Could I follow up?
Yes.
So, would you agree that what we're doing right now is probably, it is the best option, because to put them in a facility that's not really suited for it, I know it can be burdensome for the families, but when we're talking about the child, until this comes online,
Yeah, I think it's all we have. The alternative is they go out of the county and they go out of our community and, where they've got friends and family coming to support them. I think, what we have on 45th Street with neurobehavioral hospitals coming online, it is a pediatric Baker Act bed. It's a private room, it's, specialists, and they get the care they need, but it's not the ideal scenario, which I think long-term, again, is pods and chairs. We get away from the bed concept.
Okay, thank you.
Thank you. Next up, we have School Board Member Whitfield.
Thank you. I'll be very brief, but some of these things came up and I just had to jump in on them. First of all, I love the idea of prevention. Thank you so much for bringing that up, Commissioner, and other Commissioner. The idea of trying to get to the kids before they are in this crisis, I think, is so important. And I know our superintendent is going to speak about some of the things we're doing at the school district, but I think our behavioral health professionals are our first line of defense. It's something that came out of the Marjorie Stoneman Douglas tragedy that I think is a very good opportunity for us. It's a way for within the school system for us to catch kids as they are first going into crisis. Their teachers, their principals know this ahead of time, so they can capture them into this system and help them. But again, with some of the challenges, and Marcia, Ms. Andrews brought this up, around transportation for these young children. We are sending them to Martin County, Broward County, and it is very difficult for a parent to visit. And so children under the age of 11, many of you have had children in this room, when you're under the age of 11, being separated from people who care about you in this crisis is really, really tough. And when you send a child to Martin County, and if a parent doesn't have transportation, trying to get there to visit them, they only get very limited amount of time with these children. They are really truly separated. There can be issues within the family, but to have no support system at all is very scary. So I think this is why it's so important that we're building this here in Palm Beach County. We're trying to create a system so that Palm Beach County is standalone. We don't have to rely on other communities. And something as critical as taking care of our children, I think is something that we have to push for here. The one question I would ask for Ms. Davis, just following up on all of this, is if you have a student who's exhibiting behaviors, however, has not said that they would like to hurt themselves, what are the services that are then available for outpatient services, or maybe someone else, maybe Ms. Fields can answer this, within our system? What services can be prior to the Baker acting, prior to the decision that they would like to
I
harm
mean, we
themselves?
currently have a pediatric psychiatrist. He has capacity. So we've worked, I know, with staff at the school district, Keith in particular, and his team to say, you know, send them to us. When somebody, you know, a parent just doesn't know what to do, we have capacity, we have a pediatric psychiatrist, and so we're trying to get them prior to a crisis.
Well, and a follow-up to that is, what is the wait time?
Right now, some of those, there is no wait time. Call us and bring them before the end of the day. So it's working when we capture the child. I don't mean it when we capture them, but I mean, when we recognize the child has a need.
In addition, there are therapists and psychologists that are available through the Youth Services Department who are providing that direct level of care. And then no one of our agencies can handle everything, and that is part of the investment with our financially assisted agencies and our community-based agencies. Many of those partners, I already mentioned the Center for Child Counseling, but other partners are providing those services under contracts with several of us to be able to meet those needs, because no one of our agencies are going to be able to handle it all.
Vice Chair Rodriguez.
Yes, I just wanted to briefly go back to the issue of the developmentally disabled population and the autistic population specifically. As we know, it's an ever-increasing population, and I just want to bring to your attention an issue that hopefully you're already looking at, which is just like you're looking at how you provide services in a way that's appropriate for children versus adult, that you have the flexibility to also be able to tailor those services when you're talking about not only a child with special needs or with autism, but an adult with special needs or with autism, because as you know, autistic individuals do not process the world around them and the information around them the same way that we do. And what may be an acceptable environment, whether it's isolation or in a group for an adult, for an autistic individual or child may traumatize them further, to the point that nothing you do afterwards really works, because now you've set them back maybe years in the recovery. So I just want to make sure that that is at the forefront of your thought as well as you tailor these programs for the special needs population.
Thank you. Yes.
School Member Savieto.
Thank you. A big issue that has added to mental health, it's something that's happening at the state and national level. Mr. Burke knows very well about it, and it's immigration. It's happening in my district, in Joel Flores, Commissioner Flores' district, which it overlaps. So when it comes to prevention, we can look at the districts that have, you know, the majority of Hispanics or people from other countries, and take a look at that. It's been hitting hard. It's really hard for me to speak about immigration without getting emotional, but I lived it when I came from Argentina when I was 13. So I know people in my district that have gone through it. We met with the Pastors Association, the Hispanic Pastors Association, maybe a month or 2 months ago with Mr. Burke and our whole team to speak to them in Spanish, of course, and in English, and to hear about what they're hearing from their people, their families. The stories are horrible. So that's very real, and it's adding to our mental health problems and challenges at the school district. So we definitely need the whole community to understand that that's an added challenge that maybe we didn't have before. But immigration is not getting any better. Some of these children are born in this country. They speak perfect English, like my son. So you probably would not know what's going on, but I would love a little more attention to that topic of immigration. Thank you.
Thank you. Lisa?
Thank you. I couldn't agree more that prevention, early intervention is really key before we get to...
Lisa, excuse me, try to speak into the mic.
Oh, sorry. I couldn't agree more that prevention, early intervention is really significant so that we don't end up in a crisis mode. Children's Services Council invests greatly in terms of really early on in the first 0 to 5. About 65% of our budget goes 0 to 5. And it focuses on everything from, you know, when mom first has baby and there's postpartum depression, all the way through more intensive services where there's homelessness, domestic violence, things like that. So we have a whole continuum of services to support our families. And there is, you know, there are, you know, it was literally the #1 issue that came up when, under the Birth to 22 Alliance went out and spoke directly to youth. It was the #1 issue that they mentioned that they're struggling with. And it really is everything from, not every child needs, you know, a therapist, or it's really the wellness, the mentoring, that, you know, children are really struggling and not feeling supported, and COVID really did a lot of damage with the social isolation. So it's an active conversation that under Birth of 22 we're having all the time. And then the only other point I'll mention is, Commissioner Weiss, when you mentioned about education, we do have a Every Parent campaign and website, and I'd like to think a little bit more about the social media, the impacts of social media and what we might be able to do to help support getting the word out to families about the impact that that has.
Commissioner Flores, you're recognized.
I will be brief because I already spoke, but since we've entered this conversation, I've had 3 different parents text me about mental health and what it does to their child and the effect that it has in their household and so on. Mental health is not just about our youth. We have a large veteran community out there too, who faces a lot of these issues on a daily basis. And I just want to bring that up, that it's not just youth. There are many different sectors in the community that are affected by mental health. We talked about 211, and they do guts work, trying to divert and connect people to resources, but they're heavily undermanned. We need more resources to be invested in 211 to have a robust program. And lastly, my last comment was, you know, we've sort of talked about some of the issues that we know, but we really haven't talked about all of the challenges that are out in this space, and really the gaps that we are dealing with. We're spending a lot of money in here, but it's not nearly enough what we need to be spending. So I think that's something that needs to be addressed. And from what I'm hearing out in the community is that these, the therapists and the people that are actually treating them are getting burnt out because we don't have nearly enough to be able to service our community. And there seems to be an issue with fielding enough therapists to do the work. So I know we've sort of touched on some of these things, but I feel like there's more gaps out there that we haven't even discussed. Thank you.
School board member Andrews, I'm going to let you speak, but then afterwards I'm going to hold comments to let staff at least finish the presentation.
And thank you. And I continue to get calls from people who are homeless. We're living in a time now where affordability, where people can't pay their rent. You know, the children are a part of that. That's why we have so many homeless children, and the school district of Palm Beach County does as much as we can to make sure that their lives aren't disrupted, to make sure that we keep them in schools and feed them and so on. But, you know, I was so happy when we did Melissa's place out in Belglade, but we still just don't have enough places when people are calling. They may not be in a crisis at the very beginning, but if they can't find a place to live with their children, their babies, and so on, and I love sitting around this table, but when it comes to what we really do have, that's why I go back to say, talk to the communities, talk to those leaders with on the ground, the churches in those communities, so people will know where to turn to, even though we have all of these people that's supposed to be doing what they're doing, and I believe they're doing it, but when people are hurting, they really want to be able to come to somebody immediately to get help. So housing is still a big issue, homelessness, feeding them, and knowing that we're all here in these positions around this table doing as best that we can. But I think there should be a table of people from those communities, not just at a League of Cities discussion, but on the ground in those communities with almost what we have here, and building from this for real voices of what it is that we truly need to do to take it to the next level, to get into those doors where those people that are suffering, that are living in their cars, with nothing to eat, and they're out there, folks, and they're calling for help.
And Commissioner Flores and School Board Member Andrews, you gave me the perfect tee up to the next slide, which is that all of the partners here at this table are working through the collective impact model on homelessness. And certainly prevention, just like in mental health, is a place where we want to start. There's distinctions between what is considered to be homelessness under McKinney-Vento with the school district versus what HUD definitions are, so it makes a difference as to which funding sources can support. We do have mechanisms for crisis response, and a lot of our community-based agencies and our nonprofits in the community are working in this arena. But I'd like to turn it over to Superintendent Burke to talk about a new platform that you started last year at the school district specifically to address these needs.
Yes, thank you, Ms. Field. So what we're looking at here, this is a snapshot of a Power BI dashboard, and it was built upon the vision of really school board member Miss Erica Whitfield. And then the builder, I got to give credit to, is Mr. Keith Oswald. But what we've done here is capture a lot of real-time data, all the student demographics, and we're such a large county that the challenge was how do we identify where the needs are, right? And how do we get services to address those needs, particularly when it comes to homelessness and food insecurity. Both passions of Ms. Whitfield's, which kind of led us down to this point, but this has been really impactful. So the snapshot doesn't really do it justice. With Power BI, if you've used these dashboards before, you can filter and kind of drill down and kind of set your parameters and really zero in on things. But this allows us to go across all of our schools. It provides all the student demographics. It's got information around attendance. We talked about earlier, chronic absenteeism, truancy is a major problem. But it lets us know which students are taking advantage of hunger relief programs, and also which students may be more at risk. The same thing with homelessness. And then this dashboard, which we've made available on our website, and you see the kind of long website address running across the bottom, this is public facing. So to all the community partners out there and working with Ms. Fields and the whole room here, the different agencies like the food bank that want to help us with food pantries or weekend feeding programs, this really gives us a tool to turn to and then say, okay, here's where the help is needed. Let's do something about it. And it's having an impact. So like Ms. Field said, it's only about a year old, and it's being utilized. And Mr. Oswald, anything you want to add about that? I know this was kind of one of your projects, but.
Just thanks to Ms. Whitfield and her vision behind it, I would say each of the county commissioners can drill into your own district to see the data and the number of homeless students that exist that we've identified through McKinney-Vento, not necessarily through the county. So it does cross-reference a number of aspects that you talked about.
Yep, and then our homeless number of students, I mean, it fluctuates throughout the school year, but I think, we can range from 4,000 to 6,000 students experiencing some type of homelessness, whether that's maybe, spending some time on someone's couch or in the car, or, in some type of assisted living. But anyway, that's more about the dashboard. I'll pop back up in a few slides. All right.
Thank you. Next, all of you should have this document, and I know it's thick. It's also available online, but this is a wealth of data, and I want to turn this over to Dr. Lisa Williams-Taylor from the Children's Services Council, and her team, along with many partners, worked to develop this, and it's been going on since that symposium.
Thank you very much. Yes, CSC and the school district really take the lead on putting this together. And as you mentioned before, it really is aggregate. So there's many partners that all come together to supply their data, and it really drives the Birth of 22 Alliance and really looking at where there's gaps or where we're doing really well and we need to sustain or do more, and then also where there's gaps and we want to do something different. To give you an example, we definitely heard from one of the work groups that mentoring specifically for children that are involved in the DJJ system was really a gap, and that was something that then we were able to come together through the United Way, CSC, and the county to youth services to come together and support those children. So we use the data on a regular basis to drive where we're going to use our dollars. The dashboard, I just have to say, we're using it for where we're putting our backpack programs, and we also have a work group on looking at literacy rates of children that are experiencing homelessness. And so, again, great work. It really is helping drive decisions for us. But also, in addition to this aggregate, how we roll up data and look at trends, where each entity is looking at their own individual data. So, for example, you'll see in your packet the healthcare district's performance report that's required by statute that rolls up their individual data. Youth Services, as Ms. Fields mentioned, is looking at working with the Center for Child Counseling on data tracking. And of course, the school district monitors students, and also you saw the dashboard. I did want to mention that CSC also tracks individual level data. So we have 23 providers that are entering data into a single system representing 62 different programs. We have access to all prenatal infant risk screens as well as developmental screens, which really helps us look at what are the needs of the children and families, and then be able to refer whether it's a program we fund or a community program, and we're able to get the family into the services they need. We also have data sharing agreements with the Department of Health, with the school district, Early Learning Coalition, Department of Children and Families, and the Department of Juvenile Justice, which helps us look at doing our own program evaluations, as well as doing longitudinal analysis to look at whether the early interventions and prevention programs really are having a long-lasting effect. I think it's important to note that our system is HIPAA compliant, meaning we abide by federal privacy laws in relation to medical information, and as well as all the other entities. All the boards here are all, because you're collecting information that's private, and so that's important to note that there are federal regulations about what can be shared and how things are shared. And of course, the school district also has FERPA, which is federal education privacy laws. So as we're talking about sharing information, we have to be really cautious and work together to see what is possible. But I know that there is work on looking at interfaces between data systems where possible. So we presented a lot of good tracking information. And it really is important to know that the community is really looking at this data on a regular basis to make good data-informed decisions of where to invest dollars.
Thank you.
When our Board of County Commissioners was having discussions about convening this meeting and getting us here, it should be no surprise that funding was one of those big issues. That was a high level of topic of interest of conversation. And in this section, we wanted to talk a little bit about that because there's a couple of different components of this. There's the issue of, what we are funding individually, collectively. Are they meeting the needs? Are they not meeting the needs? Where the responsibilities might lie in doing that, and how well we've done collectively in addressing some of these other policy issues that we've talked about. So this slide just gives you a very high level in terms of, as the four entities are all taxing authorities that have the ability to levy millage. Some are more restricted than others in different capacities. But from the county's perspective, our 4.5 mills is our county operating, and our debt you see up there as well. We also levy for our libraries as well as our fire rescue. We collect about $2.1 billion a year collectively amongst all of those entities in terms of taxes, property taxes that we're able to collect. And of that, a lot of that goes back into serving some of the children in our community. I mean, specifically, we have a youth services department, our community services department, very engaged with issues with children. Our parks, very robust in terms of children's services. Our POMTRAN in terms of providing rides to a number of kids to public schools throughout the community. So all important services that we provide, but all topics of conversation that have come up before our Board of County Commissioners about how we fund that, how much we fund it, and as we look forward. And as maybe some of you have heard, a few folks in Tallahassee have said that maybe we're spending too much money in some places or another in the county. And our county administrator and our Board of County Commissioners have been responding to that to ensure that, number one, we're doing things and continue to do things as effectively and efficiently as we can. But our board has also been extremely responsible about cutting taxes in the past, having twice in the last 4 years reducing millage rate and also eliminating our infrastructure surtax at the end of this year. So 3 tax cuts over the last 4 years. Our public schools, obviously, and you'll hear from Superintendent Burke very shortly, but certainly have limitations as well from the Florida legislature in terms of how they raise their millage, as well as reductions that they've seen from Tallahassee and what some of those impacts have been in terms of where they're able to garner some of the new dollars they have to meet some of those needs. And then on the independent special district side, there are specific limitations that you'll hear about in each of those respective districts in terms of what they're able to spend their dollars on. And then Lisa will share a little bit about where those dollars go in terms of the age ranges and the programs that they provide. So wanted to have a healthy conversation over the next couple of slides with each of the entities and amongst the respective boards about our funding and limitations we have, needs we have, and how we're working collectively together. So I'll turn it over to Superintendent Burke to just share a little bit about school district and your funding.
Thank you. Mr. Von Laren, you did a nice job of outlining it. School districts are kind of unique, so we've got 4 different taxing authorities here in Palm Beach County at the table. For school districts, the state legislature, through their annual budget process, really determines the bulk of our funding. Through the Florida Education Finance Program, they're going to settle on a number, you know, that last year was about $9,500 per student, and then they tell the school board, this is your required local effort. That's the biggest component of our millage, and they say by state law, you must levy this tax. And that's what you saw on the previous slide, by state law. And so what that means is across our state, if everyone's getting, you know, basically that $9,500 per student, the portion that's funded locally will vary from county to county. The 3-point-something mills in Palm Beach County is going to generate about 70% of the funding, where if you were in a county that's more rural and less property value, they'll see less local sources and more state revenue coming in, which is typically derived primarily from state sales tax. So that's my main point as well. We're considered an independent taxing authority. The independence is really subjective because the board is told by the state through that state annual budget process, this is what your tax levy will be, and then the other components are actually capped by state statute. So for capital improvements, we're capped at 1.5 mils, and there's some other components we can levy. And then if really the school board wants to bring more revenue to the table, that's where we turn to the voters, and we've done that successfully. On this slide here, you see a little story in the margin, and it's titled The Perfect Storm, but this is just a good example of what we're facing currently this school year. So, you know, the state leaders have been focused on trying to reduce expenditures statewide. That resulted in a pretty lean budget for us for the current school year. We saw an overall funding increase of 1.3%. 0.6% of that was for teacher pay, and obviously that didn't go very far with our teachers. So we're actually at impasse right now with our teachers trying to work to a salary settlement, but we're going through the impasse process. And we're able to offer a package that was far beyond that, but it still was not accepted yet. But what really complicated our budget situation this year was an unexpected decline in student enrollment. We were projected by the state and even by our own demographer that we thought we'd be down about 400 or 500 students. And when we got to our annual 11-day count, we were down nearly 6,000. We were down about 5,600, and then by October that had slipped to 6,000. So we saw some major kind of changes in the demographic trends. You know, you're probably aware of the state universal voucher program, Florida, our family empowerment scholarships. That's a piece of it, but it's a relatively minor piece. We're seeing, I think the bigger shifts are really a byproduct of immigration policies, where we have fewer families moving into Palm Beach County. We're actually starting to see a decline in our students that speak English as a second language, where they're English language learners. So, but when we lose students, we lose money immediately, the same school year. So that's why I've just mentioned that we have currently a $40 million budget shortfall that I'm confident our CFO, Ms. Heather Frederick, is going to address. We have a budget workshop tomorrow. And for our school board, it's challenging, right? Because they hear from their constituents, they hear from their teachers, they'd love to pay them more, but they really can't. They don't really have the option to raise the millage. So being a school board member is not for the faint of the heart. They've got to have cast iron stomachs, and they're doing well with it. And then when you just look at our funding, you know, it's just like the county. We have that operating budget that we can use to spend for the day-to-day costs to serve our students, that's primarily teacher salaries, other employees. We have a capital budget. Those expenditures have to be for lawful capital outlay items like, you know, renovating, maintaining our schools, buying buses, computers, that type of thing. And then the referendums I just want to touch on because that is really what's helped us address a lot of the needs we've talked about today. So in 2018, in the wake of the Stoneman Douglas tragedy, and also growing frustrated that we were unable to pay our teachers more, we went to voters for a 1 mil levy. I want to thank the county commission for allowing that to move forward and be placed on the ballot with the supervisor of elections. But that 1 mil has allowed us to improve teacher pay, shore up safety measures, and put that behavioral health professional in every one of our schools. And on top of that one professional, we're able to do multi-tiered systems of support, and we can bring in co-located therapists that we pay for out of those funds for those students that need more than just a quick trip to the counselor or the behavioral health professional, but may need some ongoing services. And I just want to thank everyone around the table from the Healthcare District to Children's Service Council. We could not do this without you. And the needs are great. You saw that number, that 24% of the kids feeling hopeless. That like just really makes me sad. That's hard to stomach. And I heard Commissioner Weiss on the cell phones. I don't necessarily disagree with you. I do think our challenges, unfortunately, it's been 12 years since the last time we got together, and I think it's pretty safe to say that the mental health needs of our students and probably most of our residents have increased over that span. Thank you.
Thank you, Superintendent. And Madam Mayor, we're going to ask Ms. Williams Taylor to just walk us through some of the components on the funding side of the Children's Services Council.
Sure. So under our statute, our funding must be, is by our name, dedicated to children, and there's no supplanting, and specifically, so nothing that's under, that's a core responsibility of another entity. And then they specifically in our statute call out the school district and say nothing that's under the exclusive jurisdiction of the school district should be funded by CSC. And then we also have some requirements by policy, board policy, that is not to fund programs for children over the age of 18. We do not fund medical services, housing, or capital improvements.
Thank you. And then Ms. Davis.
Yes, so a few key takeaways about the healthcare district. I think first and foremost, I think it's important for people to understand we're primarily a provider of healthcare, not a funder. So the majority of our budget is for our own physicians and nurses and all that. We have, many people don't realize that we have a hospital in the Glades. We have, nurses in the schools. We have a skilled nursing facility. We have the Trauma Hawk helicopters, federally qualified health centers. So we have, and of course our investment in mental health. We're here to fill the gaps in healthcare. But we truly are a public health entity. And really what I want to call out is that definition of how we utilize our dollars, and it's utilizing limited resources to achieve the greatest impact. So while there are certain things that are phenomenal programs, they don't necessarily lend themselves to being funded with taxpayer dollars, perhaps philanthropy for somebody else to pay for, but not using taxpayer dollars to help only a few. So we're trying to help the largest number of people. I think there's also an algorithm we go through when somebody comes to us and says, you should be doing the following things. The first question is it evidence-based healthcare? There are a lot of things that people want to throw in the healthcare bucket or the wellness bucket and say, you should be doing this. And I'm not going to pick on anything except, like, hey, go yoga. It's really good for the mind. Yes, it is. But, is it going to be good for the greater the number of people? Is there evidence-based? Does Medicare or Medicaid pay for it? Because that's always the thing that we use as our, North Star. If a federal agency or a state agency has agreed that this is truly healthcare, then we tend to fall in line and agree. And then we look at the rates. What does Medicare or Medicaid pay for that service? So yes, they agree that it's healthcare, but they're paying X dollars. That gives us a really good indication of whether it's something the healthcare district should be funding or be in that space. And then, of course, we're always looking at duplication of services. And in particular, we often get confused. People think we are the health department. They think we're fire rescue. They think we're the school district. We don't always know who we are and what we do, but we're always looking to see if someone else is doing it, and are we that resource of last resort?
So, Madam Mayor, we have 2 slides left in our presentation, and these are some of the takeaway components from the meeting. We can certainly get through the rest of those if you'd like us to do that. Okay, we'll do that. So, one of the things collectively from staff that we looked at when we came together and were putting together the pieces of the presentation, we're certainly on the back end of the conversations that we're going to have today, and that is, what are some of the things that we take away from this joint meeting? One of those that we know is important to all of us are things that the legislature does. And so we came up with a list of what we thought were some legislative items that potentially we could craft into a letter of joint support from our respective boards. And on your table, underneath the folder that we placed there, there's a 3-page letter that says draft on it in red. And we just put that together, no pride in ownership there or anything. We just really put it together to flow through some of these bullet points for you, just to kind of share some of the issues that collectively we thought could be important and things that each of our boards would feel comfortable in advancing collectively. Obviously, the first one being property taxes, and we had the opportunity a few weeks ago, our board, to spend 3 hours in a workshop with the chair of this House Property Tax Committee, going over some of those proposals and what they mean to our collective budget. The main bill that's moving through the legislature right now would be over a $600 million hit to Palm Beach County's budget. That is roughly equal to the amount of money that the BCC spends in all of their departments that they fund, excluding public safety departments. So tremendous impact, and I know that some of our special districts are in the same boat. The school board, while they might not be worried at the moment right now about potential property tax costs or cuts, they certainly are about individual funding per student allocation, and we, the county, have supported those allocations before as part of our legislative program. Sovereign immunity is something I think that impacts each and every one of us as a government entity, and the legislature has been looking at moving some of those limits to a little bit higher, which at the same time, while they're talking about property taxes and reductions, certainly has got our antennas up. The healthcare district has an individual request for a helicopter for multi-mission efforts, which we are supporting that effort, and then some of the other career technical education funding that we've included in this, the safeguarding of public facilities and campuses, and specifically what we're talking about here is infrastructure hardening, emergency communications, and also behavioral threat assessments as part of safeguarding those campuses, and then moving to a full day of voluntary pre-K, which my wife and I are very in favor of. And then also on the federal side, as we've seen lately, Supplemental Nutrition Assistance Program and WIC that came under attack, and asking the legislature to join us and asking the federal government to support those very important funding sources to our community, and then also the local impact if the federal government requires treatment of homeless individuals that we discussed a little bit earlier. And I think that our county administrator, Mr. Abruzzo, might have a few things to add to that as well.
Thank you, Chief Deputy Administrator. I appreciate it. To piggyback on the beginning of this slide, to add
Excuse me, Administrator, if you could please speak into the mic.
Could you hear me better now?
Better now.
All right, I will lean forward. I thanked our Chief Deputy. I wanted to add some context to the beginning, a couple bullet points on the front of the slide, property taxes, and what we are looking at county administration. I'm excluding the CFO's comments from several days ago. To me, that is a personal opinion. We, the county, that was not Doge. We, the county, have not received any type of audit or investigation from the state to what the CFO is alluding to. However, On my first day in the position, we are under an official Doge audit, where Doge is engaging with us in a very detailed way. I have had multiple conversations, probably I would say about bi-weekly to at least once every 3 months with the director of Doge, Eric Soskin. He is, without question, they are keying in on our community services and youth services. And I bring that up because I do, Coast Guard, Semper Paratus, always ready. I am preparing that the state will request cuts in those departments specifically. So what does that mean? And I think this is important for this broader discussion, especially for the CSC. We may need help. We may need help because I don't know what the state is going to levy on our board. And we'll have to work together when it comes, but I would put money on that something is coming. Thank you, Madam Mayor.
Thank you, Administrator. And I'm going to kind of elaborate on that a little bit. So in all the discussions that we seem to be hearing from the state on whichever legislation happens to go on the ballot, something is going to get reduced at some level. It seems that they have specifically said they are not going to, it will not impact the school board, any kind of taxing for the school board, for public safety, for voter approved MSTUs. So with that being said, that means they are specifically coming after the county's ad valorem taxes. And so with the Children's Services Council, and for those that don't know, I was on it up until the past few weeks. Commissioner Flores will be taking my seat on the Children's Services Council. So I've been very familiar with that process as well. And that MSTU is also voted on every year. And you may need to consider what you want to do going forward with that to make up dollars. I've been saying this all along, that the Children's Services Council does bring in a lot of money every year. And I do not think there can ever be enough money to solve every problem that is out there. That is an impossible task. You cannot buy your way out of problems. That's impossible. But I will say I would like to ask the Children's Services Council specifically to start really considering a plan forward, because should something go on the ballot, you have the ability to continue helping children with your dollars. But our board is going to have to take a serious look at ways that we're going to have to readjust. So I just want you to keep that in mind, and I will turn it back over to you, Todd.
Thank you, Madam Mayor. So if you all wanted to just take a look at this document that I gave you, certainly if there's any of these issues that are ones that you have any concern with and how we've drafted it, please let us know. If we're missing something here that you think rises up to this level, and there were a lot of issues that we could have included on this, believe me, we bounced a number around, but try to narrow it down to something that was somewhat reasonable if we were going to share something collectively to leadership in the legislature. So please, you can take a look at that, and we can maybe take some action on that a little bit later in the meeting after you've had some further discussion on this particular item. Okay. Anything else? Any other comments right now? Sir. Got you.
Mr. Bean, you're recognized.
Did you want comments? Did you want comments now?
Sure.
Generally speaking, I'm okay with what's on here. My only concern is it's a letter to me that can be easily just kind of put aside. Okay, great, documented, fine, put it over here. I think providing a little more context for each of the requests would be helpful. You don't have to go into long, elaborate rationale and reasons, but, you know, providing, like, as an example, you know, the, let's pick on healthcare district with the helicopter. You know, we understand Palm Beach County is urban, rural, agricultural, suburban, coastal, you know, in the lake, but going up to Tallahassee, trying to help remind legislators, or I guess in this case, the speaker in particular, you know, how large our county is, and why this would be so beneficial to our residents, as an example. Again, it doesn't have to be, you know, extra paragraphs in each one, but some sort of key line example as to why we're making this ask. It's not just, oh, protect this or what have you, but that, no, we understand the goals of the state, but these are our concerns that we need to make sure we address for our residents.
Clear. Thank you.
School Board Member Ferguson and Superintendent Burke.
Thank you, Madam Chair, and I'll be excusing myself shortly. I sit on a number of boards that annually put in the request for full-day voluntary pre-kindergarten. I don't support that. I don't think they really are reading the room in Tallahassee, particularly on the heels of newly enacted DOGE. That's a very high nine-figure annual financial contribution consideration. And so I think we should try to limit and pare these things down as small as possible to try to get a deal done annually. Now, if you say long-term, you want to try to get this full-day voluntary pre-kindergarten, fine, but I would let everybody know that that's been something that's been bandied about in Florida for over 20 years, and we still haven't gotten it. It's just more expensive now, and you don't really have the political appetite in Tallahassee. So I would encourage persons just to kind of scrap that from this very well-drafted letter. I would say, though, from the county and from the municipalities, I think we are missing the ball to a certain degree. So you can look at the kindergarten readiness scores and see that roughly half of the children are not kindergarten ready. So basically, one thing that I've noticed, and I think other persons have noticed as well, is that children who start behind tend to stay behind. Those who start ahead tend to stay ahead. So I think we need to do a better job from the county, from the municipalities, and the school board as well, getting that information out into the respective homes, irrespective of whether your mom or your dad has $1 million in the bank account or $10,000 in the bank account. There's certain metrics that you should be able to master by age 2, 3, 4, and 5. And if you do, the district is your best choice, at least here in Palm Beach County, for purposes of education. And so a lot of times I come to these meetings, I feel like there's a lot of doom and gloom. Almost everyone I go to is doom and gloom, less money, less money, less money. But you don't need money to disseminate information and knowledge out into these households. So I would encourage everybody in their respective networks to focus on that. And again, Madam Chair, the full-day voluntary pre-K, it just ain't happening. Not here in Florida and most states, as far as I can tell, across the country. So I really think we should do a better job of paring down our legislative platforms. And that goes not just here, but in every way. These people are being inundated by this group, that group, and another group, asking for 1,000 things under the sun. It's not going to happen. I think if we read the room and understand where they are, we'll have a better chance of getting the one or two things that we should be putting forward actually across the finish line. But this is an exceptionally well-drafted letter. I just think that one thing probably should be removed. And I'm going to excuse myself because I'm feeling a little bit under the weather, but you're all aces in my book. Be well, Merry Christmas, and Happy New Year.
May I ask you a quick question before you leave? Were there
Yes, ma'am.
two specific items on this letter that you would like to hone in on?
The one that I have most concern with is the full-day voluntary pre-K, Madam Chair, because it's not going to happen at this point.
So you want to eliminate that from the letter?
I would, because I sit on several other boards where we constantly push this through every single year, and the legislators just look at us like we got 3 eyes and 2 heads. I just think it should be removed. I don't think it's practical, and I think the majority of things we put forward on the legislative platform should have some likelihood of getting passed. It shouldn't just be, okay, thank you for your time, going to the next legislator's office. Like,
Were there anything else?
that's the only thing that I took exception to. Everything else, like I said, is well thought out, well crafted. The CTE is definitely something that we need to focus more on. As evidenced again by recently enacted legislation, as far as that goes. Everything else seems to match up, respectfully. But the full-day voluntary pre-kindergarten, I just don't see the need for it. But again, thank you for your time, and
Thank you.
happy holidays and happy
better.
New Year.
We have a list growing. I have Burke, Vice Mayor Woodward, Commissioner Flores, and School Board Member Brill.
Thank you. I just want to speak briefly on the property tax issue because I am concerned about it. Even though at this point, it looks like school districts are going to be left out of that. We know we benefit from your services. They benefit our families, our parents, our students, and if you all get squeezed through a constitutional amendment, I'm sure it's going to spill over into what we're able to do for our students. I just want to point out that schools being exempted from the property tax proposals, I don't think it's an act of great benevolence. I think it's an act of necessity. The school, the legislature and the governor are required to balance the state budget each year, and education's a part of that budget. And if they were to take local property taxes out of the education budget, when they're already sitting at 46 in the nation, there's it's almost, it would just be impossible. Sales tax would have to be jacked up to, I don't even know what it'd be. It'd probably have to be 20% sales tax or something. So I think that's why schools are left out of it, and we're thankful for that. But we do recognize that these services are important, and it impacts the quality of life and the condition of our students when they arrive at our schools each day, from crossing guards to nurses. So the good thing is those constitutional amendments take a 60% vote or higher, and that's a tough bar to get to. And hopefully, if our community is paying attention, they should be really looking and saying, what services am I willing to part ways with before they make that vote? That's it. I just wanted to put that on the table because I think it's important.
Thank you.
Thank you, Mayor. First, I would like to, when we asked for this meeting a few months ago, we were aware that we were being dosed. Now we're hyperspeed into a process here. I just wanted to go on page 32. It's the slide for Children's Services Council. And it's very interesting to me, and it's a good policy, I believe, that you have anything that is the core responsibility of another agency. And it's a question that we have had to start really asking ourselves the hard questions. And it's not just us. Our residents are asking us the same question. And I have conversations on a daily basis with people in the community that I respect, that are very involved and aware, I thought, of what we do, and who think it's wonderful. Let's get rid of property taxes. And of course, I sit there with, well, really? Let's talk about it. And after, a conversation that any of you in this room could have, people are suddenly aware of what we use our property taxes for the most part. However, there are parts where we are funding things that is not our core responsibility. And we as the county have the most flexibility of any of the taxing districts sitting in this room. And I think that's probably how we got to this place. Because when there's a gap, we have the most flexibility to fill that gap. However, the current world that we're sitting in, whether or not it's the CFO's opinion, it's also a lot of our residents' opinion. And they read a headline, and here we are. And we are going to have to answer for this. Something is going to be on the ballot next year. Unclear what that will be, but in the meantime, part of these conversations are going to be also for the general public to understand, what are we doing with their money? And we've been talking about, people are hurting, there's need, all of this. That need continues to grow, and whether we like it or not, or we believe it or not, property taxes are viewed as a part of the problem of the expense of living here, and it's creating more of a problem. So we are going to have some uncomfortable, awkward conversations with each other and answer for this. Whether Tallahassee wants to throw the hammer down on us or not, it's kind of, to me, irrelevant, because our citizens are going to, and we answer to them. And the headlines are what they are, and we have to deal with this. So this letter, I couldn't agree more with what Member Ferguson said. I think less is definitely more. I checked 3 things on here that I felt, would be important, but, it's up for other people to say too. Property taxes, whether or not they're coming for the rest of you yet, property taxes are, it's a priority, I do believe. I agree with the CTE funding, career and technical education. I also think that this is something that, Tallahassee also has an appetite for. This is funding future workers through education. So I think that this is definitely something, if we're going to push for funding, this is something that could pass and should pass. And I also like, safeguarding public facilities and campuses. We've already heard from Tallahassee that public safety, law enforcement is not to be touched with any of this. So again, this is something that there is an appetite for us to push forward to get, to all of us together, whether it's county buildings, our schools, public safety is something that Tallahassee does care about. And so those 3 things, I just think that lesser is more. It doesn't have to be the 3. There's a number of cards up. I know people who want to speak, but when we all go together, you know, however, when we go with groups, if we're hitting just a few items, not pages of it, just a few items, and really every single person that we talk to when we go up there, I think it has more impact. And this is a time where, you know, it is not a time for us to be shooting for the moon to ask for a lot, but for asking for things that, again, we're reading the room, not just up there, but also locally. And again, for us, we are going to have some difficult discussions, us as a board, on how we're spending our taxpayer dollars. And we have to answer in both directions. And I think we are gonna have to make some tough decisions, and hopefully these other taxing districts that exist, a lot of the programs that have been put into place, they're great. But I think for us, we're gonna have to kind of identify our lane, just like we stay in our lane, and there are multiple lanes. We're all going together in the same direction. We're not leaving, we're not exiting. But for right now, it's a bit of a course correction, at least the way I see things moving forward. That we have less than a year before this goes on the ballot, but it'll be here in a flash. And these are things that, part of the discussion when we're talking to the public, these are the things we're gonna have to talk to them about as this discussion moves forward. And this is a statewide initiative. People love the idea of, shoot, yeah, let me get rid of that property tax. And part of that's on us, that we haven't done a good job of saying what we do. There's a lot of hidden work that happens to that road that gets to your house or to your school, the water, the storm drainage, public safety, emergency operations. We could go through the list of what we do. We know it, they don't. And a lot of that's our fault. Some of it's our fault because we've done a good job, because it hasn't been a problem. People know when things are going wrong. We've done a good job of keeping things right, but we also need to let them know all the things that are at risk and the hard decisions that we're going to have to make. And for some of this stuff, hopefully the rest of you can help us make up the difference on what is coming. So that's all I have to say. Thank you.
Commissioner Flores, you're recognized.
The good news is that's why we're in this table. We get to make these decisions. We get to be the ones to help solve some of these issues for our community. I want to bring up your attention to slide 31. We are ranked 46 in the nation. Let me repeat that. We're ranked 46 in spending in our children in education. And Florida is the fourth largest GDP in the United States. Folks, some of the issues that all of these entities that are sitting here today stem from a lack of funding from the state and our youth. Some of the issues that stem from mental health is because of this right here. Homelessness. It's all correlated. And yet, the state, once again, wants to limit our ability to invest in our community. The reason that people choose to move to Palm Beach County is because who we are, what we've invested into our community. It's because we do God's work in our communities. And it's not perfect out there. We have high poverty rates. We have to send backpacks so that our kids get fed over the weekend. Our homeless count is over 2,000. Is that correct, Mr. Green?
It's close to it.
Close to it. The state also told us that we can't have people sleeping outside businesses. So we constantly get told what to do, how to do it, but we're not going to fund you. And we're going to take more money away from you. Listen, I don't want to raise taxes on anybody. Nobody wants to pay taxes. But unfortunately, that's what makes this nation great. If you look across and you compare us to other nations, they don't do nearly what we do. And that's because we all pay taxes. Do we all want to pay taxes? Absolutely not. But, as we move forward, I think we all have to band together, because this is going to affect every single entity here, whether you like it or not. I heard our administrator, Abruzzo, mention CSC. Hey, we're going to need your help. But, the homestead property tax cut is going to hit them as well. I'm assuming it's going to hit the healthcare district as well. So there's going to be less dollars to do the work that we have to do in our community right now. We have to come together. We have to educate our constituents and let them know exactly what we do, how we do it, and the impact that it's going to have in our community. So I just want to let you know that even though the school board might not be affected, a lot of the wraparound services that are offered by the community are going to be affected. There's going to be a lot more kids going home, not sure what's going to happen because they're not going to have the resources to be successful at school. There's going to be a lot of other programs that are going to be cut. So, you know, I come to you with a humble heart because I know what this is going to look like if we have a 40-50% cut in our homestead property taxes. So I hope that we, you know, I'm in favor of the letter. I you know, in the MPO, the Metropolitan Planning Organization, we have this Vision Zero, which is that we have no casualties in Palm Beach County, and we've adopted that Vision Zero. Do we really believe that that'll happen? Probably not. But we should aim to keep everybody safe. And I believe that VPK all day should be something that we afford our children all day. And even though it's sort of like a pie in the sky idea, I think we should constantly thrive to be better than we are today. So thank you for your time. Thank you, everybody, for being here today. And I really hope that we're able to continue doing the work that we're doing and making Palm Beach County better every single day. Thank you.
Madam Mayor, can I have a point of clarification real quick?
Yes, Administrator Bruzzo, you're recognized.
Thank you, Madam Mayor. Commissioner, and thank you for your comments. I just want to be clear on one item. My remarks, although a House Bill 201, which would eliminate 90% of your budget, commissioners, that's one thing to the side. I was also speaking as if that doesn't happen, because we do not know what's coming on the ballot. We do not know what the state Senate's going to do. We don't know any of the above, so there's nothing on the ballot at this time. What I do know is that DOJ has come on to into our government center. What I do know, I was asked point blank on my second day holding the position, why do you have a youth services department when you have a special taxing district that's supposed to handle youth services? So I have a strong feeling and an inclination that we're going to be furnished the state report at some time to answer these difficult questions, irrespective if something gets put on the ballot or not. And that's where I was coming from, Commissioner. Thank you.
Thank you. Next up, we have School Board Member Brill and then School Board Member Whitfield.
Thank you so much. Thank you, and thank you, Commissioner Flores and Commissioner Woodward, for your comments. I want to start off just saying the elephant in the room is that there's no way the state of Florida is ever going to hold public schools harmless. The state of Florida, Tallahassee, the elected officials, the Commissioner of Education are putting things in place to eliminate public education. We know that. We're under attack. So regardless of what happens with the taxing authority, public education is in jeopardy here in Florida, and I'm very proud of the work that the district has done. I want to address the letter. First of all, I think it's a great idea to put something together. I think we should bring it back to our respective boards and come back with suggestions. I would say that we need to copy our entire delegation as well as all the committee members, and that we can use these as talking points throughout all of our visits up in Tallahassee. As far as the number of items, my board may remember I've always been the one that says, I don't like laundry lists, and I fought to reduce the number of items we've had, but I can tell you, I don't see this list as being very extensive. I don't see it as being too long. I will address at our board meeting, Mr. Ferguson, I don't want to speak out of turn without him here, but full day voluntary pre-VPK is on our platform. So it's something that our board has agreed to. It's also something that the Economic Council and the business community wants. So my suggestion would be that we go back to our boards, because I think this is a great idea. the more we can put in front of the elected officials, the more that we can echo with each other. I know the Coalition of West Boynton Residential Associations has put together their platform, and they've inserted some of the items from the school district. I know other organizations have. We need to echo each other's thoughts, echo each other's priorities, and work together. So I think this is a living and breathing tool. We have a little time, hoping that if everybody agrees to bring it back to their boards, that we can get it on as a discussion item at our board meeting next week of the school board, and that we come back with a document that we can bring forward. Thank you.
Thank you. School Board Member Whitfield, you're recognized.
Thank you very much. So I have a few comments that I want to make. First of all, I think it's important for us to recognize the difficulty of living in Palm Beach County, and I understand the motivation behind people wanting to reduce costs for everyone. I think this is very important. We are living in a time when it is exceptionally difficult to live here. Personally, I would like them to look at insurance rates more than property taxes. I think that insurance rates are one of the biggest issues we have in the state of Florida. And when we're looking at property taxes, these go to the services that we've all come to really need and want in our community. I think the thing that's coming forward to us right now is deciding which one of the property tax proposals is going to go on the ballot. And so as we are in this process, and many of us will be in Tallahassee and talking to our legislators, I think we are really having an opportunity to advocate for the least impactful option. And so I think that's where we sit as a community, and it's our number one issue, is saying, okay, we understand that you're going to make this step. How can we make that the least impactful? And here's why we need it here in Palm Beach County. Here's what we're using our property tax dollars for that we don't want to lose. So, but I think it's very important that we also, that we recognize that there is a need for making things cheaper here in Palm Beach County. So once we figure out what our property tax situation is going to be, I think that this group of individuals, everyone should be coming together to talk about what the duplication of services is. I think there is not really a whole lot of duplication. There's a lot of collaboration. And so there's a lot of organizations here that are working to collaborate. Specifically with the Youth Services Department, I see Youth Services as a way for us to coordinate among the different agencies to be able to provide the best services in our community. Maybe there's places that it can be cut and delegated the responsibilities, but I don't want to see our mental health programs here in Palm Beach County suffer because we've decided to cut funding from the county. If there's a way that we can trim, I'm all for it. Again, we need to reduce how much money things cost here in Palm Beach County, but I don't want to see us doing a wholesale shutting down of a department without looking at the impacts that it's going to cause for the entire county. So when we start looking at youth services and we're deciding to remove that department, how are we going to truly split up the work? Because it is a community service. There are many community entities, and we're doing this work because there's a need in the community. I don't think anyone's just inventing work to do over in your department. So if the work still must be done, and I believe it must, how do we make sure that that work is being spread out so we can do it? And also, I'd like to say that the reason why these departments were created and why we talked about, Ms. Fields talked about the history. We went in 2012, there was a tragedy. In 2016, 17, there was a tragedy. We developed all of this work, and progress has been made. We've seen it through the work of Children's Services Council. We've seen these numbers coming down. We've seen the actions that we've taken actually reduce people in homelessness and hunger in our community. We've seen the numbers going up. So with that progress, I don't want to lose what we've done so far. Finally, I want to say about the letter, the VPK issue. First of all, we have Warren Eldridge in the room. He runs our Early Learning Coalition. He might be best suited to speak to a legislative priority around that. However, similar to what Ms. Brill said, I think VPK really ties into workforce. We're talking about parents being able to drop their children off at a safe place where they can then learn and then become better members of our society and hopefully productive citizens. But also, mom and dad don't have to leave to be able to go pick up their kids at a half day and try to figure out where they go. CSE steps in with wraparound services currently. I don't want to see any of those wraparound services go away. Maybe they need to be grown. But I think that when we're looking at VPK and a full day, what we're really saying is we need to be able to make sure that a child has a place to be that is safe for an entire day. So, because right now, I'm not picking up my child at school because I'm here, but luckily she's in a safe place where she can stay until 4 o'clock, just in case anybody was wondering. So, that wonderful place that she can stay, she's learning, she's being engaged. Not all of it is education. It's not a full day of learning, but it is a full day of care, services, and support. And I think that's what we're asking for as a community. Mayor, would it be okay if Warren comes up to speak for a minute?
We have at least 7 people left to speak, so if you don't mind, if we could wait till the end, I think it might be more appropriate.
Thank you.
Of course. Commissioner Powell, you're recognized.
Thank you, Thank you, Madam Mayor. To reference the letter, for those of us who are looking at this letter that is going to the Speaker of the House, Danny Perez, and the Honorable Senate President Ben Albright, please keep in mind that although we are going to Palm Beach County Legislative Delegation Day or Palm Beach County Day, the legislature is not just Palm Beach County Day. So that although we as a coalition of people will go to advocate, there are at least 13 people who are legislators from Palm Beach County who are advocating every day. When I hear people, and because I spent so much time up there, a lot of time, morning, noon, and night, dealing specifically with legislation, and a lot of it directly impacting Palm Beach County, I want to make sure that people understand that your legislative delegation is responsible for making sure that they advocate on behalf of Palm Beach County for the issues that we know are impactful. Myself, Joe Bruzzo, Maria Sachs, Pat Rooney have all had the opportunity, and we can all tell you that it's not just Palm Beach County Day. Although when you do come up for Palm Beach County Day to speak to the legislators, it makes a difference. But we're there, what we used to be there, sometimes until 1, 2, 3 o'clock in the morning, working on these issues, speaking directly to the Senate President, speaking directly to the appropriations chairs of the different committees, directly to the head appropriations chair for both the Senate and the House. And those of us who had been in the Senate and the House could work both sides because we had those relationships. So please keep in mind that this is just a small list. When I hear people say this is too much, there are little communities, there are little counties, smaller counties than Palm Beach County that go and ask for more than what we've asked for on this list. So this is a drop in the bucket to me. I also want to, I don't want to contradict anyone, but as someone who has a small child or an emerging child, to hear people say that we should not have a full day of VPK is a challenge to me, because in the same sentence, you say that we understand that children who start kindergarten behind never catch up. That means when they graduate from high school, oh, let me stop. If they never catch up, they don't graduate from high school. They don't go get a trade. They end up somewhere else. They end up, sometimes they're going to school and they're homeless. They end up in jail. They end up in a system. So it's up to us to advocate for our children at all costs. Myself and Warren Eldridge, along with a former school board member and a team of people in Palm Beach County, pushed forth a pilot program one year to extend early childhood education for a specific area, and that's something that we should definitely look at. Funding. We talk about what the state doesn't have, and we're looking at cuts. The state has a $115 billion budget. I found a few years ago that the state was able to pass legislation so that every student in the state of Florida could receive a voucher to go to a private school. I'm trying to figure out the problem. Why are we asking for less? When my eyes are open, I don't give up, I get up. And we have to make sure that we're willing to get up. I didn't get elected to lay down. I've heard the conversation with regard to Doge and property taxes and the doom and gloom about what we could lose, and also the comments related to what voters may vote for. Remember, if this makes it to the ballot, We don't even know what will make it to the ballot. Let me be the voice of reason there. We don't know what's potentially going to go on the ballot, and we won't know until session ends. And according to last year, we don't know when session will end. Used to be 60 days. There's the potential to be up until June. But we should start working after we find out what exactly passes. And then when it does get on the ballot, if something gets on the ballot, it has to pass by 60% of the vote. I can tell you, as somebody who's been elected a few times, quite a few times, people who vote are not stupid. They're not dumb. They know what they'll lose, potentially. It has to make sense. And I can tell you, I know the people who vote are not dumb because clearly they voted for me a bunch of times. Just saying. By large margins. By large margins. But I just want to make sure that we are here, those of us who are elected, those of us who are advocating for the people in our communities, to understand it's our responsibility to fight for what we want, not to wake up and start asking for less. I don't teach my daughter or my wife to wake up and look at the world and ask for smaller amounts. Go after what we need, because in Palm Beach County, nobody's afraid of a 3-year-old. Nobody's afraid of a 4-year-old, a 5-year-old, a 6-year-old. But 10 years later, when those kids are 15 and 16 and 17, now people are figuring out ways to figure out how to incarcerate them because the dangers of these teenagers and the things that they find their hands on. We need to invest in them early on the front end so that you're not suffering the consequences on the back end. This is our county, this is our community, and if we're put in positions to advocate for people, it's our responsibility to get up and not give up. Thank you.
Thank you. Kathleen Ward.
Thank you. I always hate going after Bobby. I appreciate the conversation, and I really wish Edwin was still here. And Commissioner Woodward, I understand the concern. I think that the letter in and of itself isn't too long. I would just want to remind all the electeds and somewhat of what Bobby, you stole my thunder. But we put ourselves into this position to fight the good fight. So let's fight it, because we know the statistics. We like to go back to, we're 46 per pupil in spending on our education. We have all these other problems. We all see what it leads to. Yes, things haven't changed, but I've been in those rooms with the partial day VPK and looked at the audience of other parents, and I have help, I have resources, and I look at them, I'm like, how are you really gonna stand up here and give a 9 to 12 hourly, which barely covers anything? We should be going after these goals. And we also, on the flip side, should be humble enough to look at, you know what, maybe there are overlapping expenses, and maybe we should be looking at that and saying, hey, what could another organization do better? I know the healthcare district did that years ago. It should be incumbent upon us, regardless of what's on the ballot, to say, what are we doing that is working in a silo that another organization could be doing? I tell that to my not-for-profits in my district all the time, because we have tons of them working and not working together, working in silos. And so while I would hope that our budgets don't get drastically cut, I think it is incumbent upon us to look, to push for the things that we know that the data is showing us, regardless if we can continue to get no, we were there and we fought that fight. And on the flip side, looking at the other things and saying, maybe Children's Services Council can pick this up. Maybe we should be looking at the Center for Child Counseling, like Tammy recommended, on their ACEs and using data and saying, hey, we can cut services by looking at prevention and by looking at technology and utilizing it. And so I don't think this is all doom and gloom. I think this is just another change where we are fighting that good fight to make sure that resources don't get cut appropriately and we don't swing a pendulum one way and then continue fighting back to get in the middle. And so I think the letter is fine as is. I'm sure the rest of the board and myself will look over it to make sure that, you know, it aligns. But I would hope that we're also looking at our partner municipalities. I can't help but think, just because I am with West Palm, that we can participate in this as well, and show support for it. So I appreciate all of you, but I really was dismayed by Edwin's comments, because he has a young child too, and he knows the benefits of it. And I know it's disheartening sometimes. We still fight.
Thank you. And just because school board member Ferguson is not here, I'll make a comment. I understood him to say that he didn't agree we should go after these. He was agreeing we should narrow our scope of what we're asking for. I also do agree with Commissioner Powell, though, that there are probably a lot more things that other smaller counties are asking for. So I do see both sides of it. And with that being said, Commissioner Marino, you're recognized, and then Commissioner Weiss next.
Thank you, and I think we're all basically saying the same thing, but what's important is we each have to go and talk to every elected official in Tally, and they need to hear the same thing from all of us, because then they know what's important from all of us. I think we need to do more for prevention and education so we don't get into the point where we are so far gone. Insurance rates, when Toby Oberdorf was with us, I brought up insurance, and there wasn't much move on that at all. And also in the letter, we talk about sovereign immunity. I think that's really important. That could be something that's going to cost all of us a lot of money in the future. And the last is unfunded mandates. That's not on this letter. And I mean, for the county, it's over $40 million of unfunded mandates. So just a reminder, this was something that we talked about in our board, so I just wanted to share it with all of you. Thank you.
Thank you. Commissioner Weiss, you're recognized.
Thank you, Mayor. You know, in looking at this, I mean, it boils down to home rule. A local community making decisions for itself on how it wants to, what the level of service people want, how they want to fund it. There, you know, we've got, I can't remember how many fiscally constrained counties there are in state of Florida. They can't pay their own bills. They don't have services. I remember hearing from one of my colleagues, one of these counties, when he was growing up, said they had no parks, they didn't have fire service, they didn't have police service. And if people want to choose to live in communities like that, they have that option. But we're Palm Beach County, and there's a level of service that people have chosen to be here because most people, and no offense to people that were born here, because thank you for being here, but most of us came from somewhere else. And to see the state continually, and this is not new, and to all the state legislators that are in this room, and there are many of you who had served up there, you know it's not, I mean, this has been going on for quite a number of years now. And so you know, property taxes is just another attack on home rule. And they'll do whatever they're going to do, and they'll put in front of the voters whatever they're going to put in front of them. And I don't think there's not much say we are going to have over that. I don't think they're going to listen to what we're trying to explain to them. As it relates to this letter, I think it's appropriate. And just circling back to the VPK, and I agree with Commissioner Ward, this is really an economic issue. And I would hope that the legislators understand that. You know, you have people that are making $15, $20, $25 an hour, and they then have to go out and find some place for their kids for the rest of the day, as well as finding the transportation to get them there. And it would be better for our economy. I mean, Florida, third largest economy in the world. We have a phenomenal, if you're in the top in Florida right now, you're living really well. But there are a lot of people, most people are not, and they're struggling. And so the full day of VPK would take one less issue off their table, probably help with some mental health issues, because a lot of mental health issues that adults are experiencing have to do with the stress that they're under. And if you can't pay your bills, that's stressful. And so that's one thing we can, I think it's important to continue to keep that on our list for those reasons. You know, in working together and trying to find, you know, that overlap, I will remind everybody that children are residents here, so the county government has responsibilities to them as well. Even though we have a Children's Services Council, they are still part of the people we serve, and we do that in a way through our library system, through our park system. But we also have community services that is helping with supports and services for them. Our community revitalization, specifically trying to help those specific low-income neighborhoods. But the youth services is also filling a gap there. And it's making sure we're informed as county commissioners as to the needs of that that group of residents. I mean, we have a veterans department, but there's a VA as well. So it's a matter of working together. And if we are funding things that somebody else can fund, I have no issue with trying to pass those off but the level of service, there's been a demonstrated need for it. If there wasn't that need, we wouldn't continue to do it. So we've seen the benefits of that, and but I as Senator Sachs, Commissioner Sachs has said, you can never be afraid of the facts or afraid of the debate, and I believe in that. So let's look at the facts, and if the facts lead us somewhere else, fine. But we have to be, as far as I'm concerned, we have to be driven by the facts.
Thank you. School Board Member Andrews, and then Vice Chair Rodriguez.
And thank you. And yes, we've been a Cadillac of taking care of our kids from all of our agencies. You can see that from what we've discussed today. And we can't wait another 5 years. I mean, we're going to have to get together more often. I would suggest, I love the letter, number one. Let me just get back there to the letter. Yes, I think this is small. I don't know if you've seen all of our legislative priorities from all of our groups. That's something we need to disseminate from all of us. Unfunded mandates, that's in ours, okay? Lots of other things we have in our legislative priorities. So all of us need to see each other's. That's the first thing. And we have to stick together, and we have to fight. Because the county, I want to tell you, Mr. James Green, I sit on a lot of your committees, the CJC, lots of your committees. I know the work that you do out in the communities. And when there's a cut at the county level, we're going to suffer. I see the summer programs you have for our children within our schools so that they can get some extra support and attention during the summer months. So we've got to fight for what we need. Full day VPK, big time. We've been talking about it for years in Palm Beach County School District to say the full day piece is very critical. The CTE, if we're going to get our children ready for employment to be able to work and do the jobs that's needed, we've got a whole lot on here. And yes, being 46 in the nation is really bad. But I just want to see us, because the mayors of all these cities that we work with as school board members, we represent everybody everywhere from all across. They're going to feel the shock if something does come down. Maybe the school board might be okay, but I think we're going to have issues too. So I think it almost needs to be a smaller subsection of this group working as things are beginning to unfold. It's going to be fluid with the legislature. You know, it doesn't happen overnight, and it goes right up until the last minute, and it never ends, Mr. Senator Bobby Powell, who is a commissioner now. So I think we need to have a smaller subsection of this group. We may have to come back together again, and we've got to communicate with all of our elected officials, as you said, because they're going to get the hit when the county gets the hit, because it's all about us taking care of one another. So it's great that we came back together today, looking at all the work that we are doing. We can't cut back. If we have to, we're going to have to kind of learn how we're going to do it together, and others will have to pick up the slack if something comes up. But communications collaboration will be very critical over these next few months, because change probably is coming, and we don't know what it's going to look like, but we need to be ahead of the game. And sure, we might be sitting here in the South County, the West County, the Central County, wherever we are going to have to be. We're going to have to get there and work together. So I see a smaller subsection of this group and this group coming back together and really educating all these mayors in these cities all across Palm Beach County, because whatever comes down, it's going to hit our children, it's going to hit our communities, And they've been used to what we've given them, which has been superb, and we still need a lot more to do. So we can't afford a cut, but if we do, we need to be prepared for it. Thank you.
Vice Chair Rodriguez?
Along the lines of proactive communication, I agree. I think the key to our success in ensuring that we can continue to deliver the services that the community needs, but from my perspective, the children of our community need, is going to be more frequent and more direct interactions between our staffs over the next 12 months. Because if I had to bet, and I could be proven wrong, I think it is very likely that you will get amendments on the ballot. I also think it's very likely tax cuts will pass. And I know that we've been looking at the council, and for us, it's going to be tens of millions of dollars of reductions in our budget. So it may not be we may not be able to absorb as much as we would be able to absorb in partnership with the other entities in this room if we were exempt. But right now, I don't see any of the bills, and I could be wrong, that exempt the special taxing districts and the Children's Services Council. So I think we should probably, my suggestion is be ready to meet shortly after whatever passes, so that we can collaboratively figure out how do we continue to try to provide the most services we can to our children. Thank you.
Thank you. Mr. Warren from the ELC, would you mind coming to a mic? You could, or just have a seat. Commissioner Flores is not here. Just getting your steps in.
Communicated before about my goal with steps.
Yes.
Yes, ma'am. Do I?
We were asked earlier to speak to some of these issues, if you wouldn't mind.
Yes, ma'am. Thank you, Madam Mayor.
Thank you.
Thank you to the County Commission. Thank you to the school board, my partners at the Children's Services Council, and the Healthcare District. Regarding the voluntary pre-kindergarten program, full day, I would like to touch on it, but I would also like to share the real issue. To touch on it, voluntary pre-kindergarten makes a substantial difference in the lives of our children. Those participating in the program enter school much more ready to learn, and last year 72% left the voluntary pre-kindergarten program at age level. With that being said, it is a big ask. And I admire the goal of putting it in here. I do think there are some ways we can work toward it. I do think we can add a change in the eligibility priorities for school readiness programs for those children who are eligible, to include wraparound services for voluntary pre-kindergarten children as an eligibility priority. That leads to, if I may, Madam Chair, just address it real quick, the main issue as it relates to early learning in Palm Beach County. May I?
Yes, please, but briefly.
This will be very briefly.
Thank you.
Very, very, very briefly, there's an allocation formula. And last year, the allocation formula does not do Palm Beach County well because it does not measure our need. We need to, I would ask for the partnerships with everybody here and working with the people in Tallahassee to make sure that they know that Palm Beach County has the need and that we should not take a $14 million cut that was proposed last year. We had language in the back of the bill that ended up getting $12 million back, and with the partnership with the Children's Services Council, we are now working our way down. But without that, my previous concept would not work because we would be working to serve the same children. So that is my ask. Please work with us to help make sure that the allocation formula is fair. Then we can address the issue of voluntary pre-kindergarten full day.
Is it your opinion the best thing we can do is to leave it in the letter to request it from the state?
I think leaving in the letter is a great goal. I do think it's going to be a challenge to get, but I will never say no, do not provide voluntary pre-kindergarten full day, because I believe it is there. I believe there are some other ways to get there, but I admire the goal.
Thank you for your comments.
Thank you.
School Board Member Savieto.
Couple things. I definitely agree with VPK. We, like Commissioner Powell said, we should not back down. We have to fight it, like Board Member Marcia Andrews said as well. I was a VPK mom, and it took a huge sacrifice to take Luca from 8 to 11 and pick him up at 10:50, leave my job at the county, pick him up, and then drive him to the babysitter to come back. That 30-minute was my lunch every day for a whole year. It was horrible. And sometimes Luca didn't make it to VPK because I was tired and I couldn't do it. So we definitely have to put it in. We have it in our legislative priorities, and we need to fight it. It's not just for the kid, right? It's just for us, the parents, the community. I learned English as an adult, so I could not teach Luca phonics and all these things that the kids are learning very young age. And in my district, my whole entire district, 51% are Hispanics. So we have to take a look at the whole picture when it comes to VPK. I very agree with Mr. Thomas Bean when he said that we should give an example, Mr. Bonlaron, of some of these items. We went to a legislative breakfast, and Representative Ann Gerwig said, do not send us emails, general emails about these, problems. Tell me how it affects you. And I think that's key. So I love the idea of explaining it, not because these people are, like you would say, stupid. They're not stupid. They're in Tallahassee. But, if we give them examples, I think they would maybe see the whole picture. So what I did, Todd, was I like these, and I definitely don't believe that there are a lot. But coming from a marketing and strategic brain, I think it looks like a lot. So instead of having all these like that, we should have 3 columns. One is called Ed and Workforce, and then we put the FEFP, the VPK, and the Career and Technical under Ed and Workforce. We have another column called Public Safety and Infrastructure. We put the helicopter one and the public facilities and campuses. And then we have the third column, we call it Governance and Fiscal Policy. That's where we put the sovereign immunity and the property taxes. So having the 3 columns with all the stuff, that would be my whole idea of how to resolve all these issues that look like a lot. Thank you.
Would it be, because it sounds like you're trying to categorize them potentially into what are already existing committees in Tallahassee?
Well, it could be, but I'm just saying, let's summarize these as in the letter. We give them the letter, and we give them all this, but not as 7 items that looks like a lot. We have the big titles with the bullet points inside. The brain, it does something magical to the brain. It's easier to absorb.
No, I understand that, but what I'm saying is, especially when we're going to Tallahassee, it is a more specific goal and of who we're meeting with, our legislators. So it's a great idea, I think, to then categorize them, Todd, if you're listening, into the different committees that are existing so that we know who and what are able to impact the different things we are fighting for. It's a great idea.
But the less committees, the better. I mean, at least for this, of course, there could be other ones, right? Environmental, God knows, many other things. But at least for this conversation, for these 7, we can use. Thank you, Commissioner Weiss and ChatGPT. He's our AI guru. And I needed one more, and I couldn't come up with it. So I did my homework here to come up with that 3rd one, which is governance and fiscal policy. But there we go. We have it.
Dr. Gunta.
Thank you. I think we had a great conversation here this afternoon, and I just wanted to really briefly comment and say that, we are a very large county. We are one of the 3 largest counties in the state of Florida. So I think this letter, as it pertains to this letter and the asks in this letter, I do not think any of them should be eliminated, including the one on VPK, as I've seen support from many other members sitting here around the table. I do also want to say that I am one of the board members with Early Learning Coalition, so I get to see firsthand the great work that ELC does and what VPK brings to the table, as well as school readiness. So I'm 100% in support of the full-day VPK staying on this letter. In addition, I do also want to say that, you know, I'm also a board member at the healthcare district, and I see how our tax dollars benefit this county so very much, and all the good work that healthcare district does for the county. And, you know, being the director at the health department 3 years ago when I stepped into this role, I had to make cuts. So we've been facing cuts at the health department since my day one of my employment. And I have, you know, gone through those cuts, but not at the cost of the health and safety for the residents of this community. When we do cut, we have to cut. There is no other way but to cut, and I am actually going through my 3rd workforce reduction at the Department of Health, but that doesn't mean that I am providing less quality of services or what the county here needs and the residents deserve. So in that light, I do turn to my partners here in the county to leverage those services which the department may not be able to provide, but that's when we collaborate with our great partners in the community and in this county. And we do have wonderful partners here sitting around this table in this county, and brilliant minds. And I think that we can face these challenges head on, and together as a group, we can come to solutions even with funding cuts. So I don't have a doubt in my mind that if we keep working together and fighting for what's right, that we in Palm Beach County will be able to establish and accomplish those goals.
Thank you so much, Lisa. You're recognized.
Thank you. Well, as we close out today, I just wanted to, you know, say that CSC really wants to be seen as a partner with everybody here, and we have fantastic collaborations with each of the entities around this table. I do think it's going to be really important to continue to educate the public about the impact of these property tax bills. We have done the analysis to our budget, and Darcy and I were just mentioning, it's a $26 to $66 million reduction to the CSC's budget. And so I just want to say it's going to be imperative that we work together as a collaborative and as staff to come up with solutions, because nobody can absorb those dollars amounts, and it's going to hit all of us the same.
Thank
So
you for that. Chair Rooney.
Thank you very much, Madam Mayor. There's a lot of things I'd like to say, but because the media's here, I'm not going to do it. So I would say, though, that I think this is it's been a very good meeting. There's been some repetitive stuff, but that's fine. That's what we're all kind of trying to come to, some kind of a consensus, which is good. Talking on a bunch of different things, Bobby's right. You know, that what we're talking about here is really what the legislative delegation, that's part of their responsibility, is to go advocate for our county. So I think that's a great point. Marcia's right. I think it would be good to get into much smaller groups of people if we are going to go up to Tallahassee and try and advocate for stuff. It's actually better, I think, in a way, if you have just a few people talking rather than have a whole group of people coming up. And at least when I was a legislator, that was more effective for me, just to talk to one or two or three people that were advocating for something. The other good thing, I think, for us is other counties are going to be affected by this, not just us. So that's, you know, the legislators are going to hear from, and the governor are going to hear from a lot of different people that are going to be impacted by this. So I don't think we have to view ourselves it's just us fighting for this. I will say, I think if this does, whatever gets onto the ballot, even though 60% is a tough number to overcome, if you're talking about people cutting taxes on anything, it's going to pass. So we have to figure out a way to make sure whatever that language is going to be the least impactful on us. As my role as the chair of the healthcare district, I think the letter's fine personally, but it's not up to me personally, and we need to have it go back before our board council and then get with our board and discuss what we think is most important and most impactful for us to for me to sign this on behalf of the board. But I'm happy to work with Todd. I've worked with Todd for a long time. Happy to work in our capacity to try to get whatever we want to put on this and work with the other entities and again, try to advocate for something that, at least from our county standpoint, can have some impact. And then, like I said, I'm sure the rest of the counties are going to be involved in this and figure out if there's a way to get with them as well, to have the most force that we can have going up to get in front of the leadership in Tallahassee to get this done. So I appreciate the folks coming here and spending time, and these meetings can be very tiresome and stuff, but this was actually a really good meeting, I think, for all of us to get together and talk about this.
So we're not going to be taking any more comments because we're going to have to wrap up. They do need the room. I'm going to close up comments with wrapping up a few things we've discussed. It seems everyone is in favor of submitting the letter without removing anything. I do agree with School Board Member Savieto, and it didn't seem like there was any objection to just recategorizing the items into potential committees up in Tallahassee. There's also adding some personal examples seemed to be a repeated thought. So if we could do that to the letter as well, that would be greatly appreciated. And lastly, I think our individual boards it would be a great idea for us when we go back to our boards to take a look at those 6 options that were presented as possible different tax proposals to go on the ballot, and for us to each choose one that we would fight for, instead of just saying we don't want anything, nothing at all, because I think as board members we understand that doesn't always work out so well. So I think as individual boards, if we could pick one that we would want to go to Tallahassee and fight for, that might be the most impactful way to address this, and then we have some say what we would like to see going forward. The Chair Oberdorf actually put one of his own bills forward, so taking a look at that might be a great place to start as well, just some ideas. And then I did like the idea of potentially coming back together, but I will leave that to the individual staff members of each board to select that date going forward. So thank you, everyone. Meeting is adjourned.